Believe it or not, it's been 5 years since life as we knew it changed. This week, March 2020, it was the beginning of the global pandemic with COVID-19.
Yes, all week long we've been focusing on some of the lessons learned from the pandemic and how some of the things that we did learn are still holding true for us today. We've got Dr. Becky Dawson, epidemiologist from Allegheny College, a woman that we have come to know over the past 5 years. She's been our medical contributor through all of it. And some of the things, Dr. Becky, that we come out on the other side learning are that these face masks that were the focus of so much controversy during the pandemic can actually help stop the spread of other things. We learned that during the subsequent flu season.
Right. I mean, it really helps with any respiratory disease. So it helped with RSV, influenza, the common cold, and then also COVID-19.
Well, let's talk about some of the things that we've learned beyond that. I mean, COVID was tough for all of us, but there are some shining moments.
There are.
So I know for me that person-to-person connection is something I undervalued prior to 2020.
Yeah, so I think that, what we all realized when we were told stay at home and only interact with the people that are in your household was that human interaction, even just the day-to-day, like the water cooler talk that we kind of like make fun of in the office, really is a huge benefit to our mental and emotional health. And we all really miss that, and there was no substitute. Being online and zooming in with one another you don't get the same interaction as like we're having when we sit on a couch and talk.
The flip side of that is when people get sick, they now realize that they do need to remove themselves sometimes.
Yeah, so it's both and, right? That like when you're sick, you actually do need to stay home. I mean, I was notorious for trying to teach through illness, and
you're not alone in that.
Right? I like power through, but like really knowing that like you need to step back, that like 2 days away actually benefits everyone so much. But then putting your phone down and having those interactions when you are healthy is, it means worlds to your mental and emotional health.
That mental health is so important.
Yeah, so we needed that human connection, but we also learned that maybe we don't need to physically go to the doctor to learn about what's going on with our health. Telehealth really kind of exploded.
Telehealth did explode, and I think that there are huge benefits to being able to jump online and have someone tell you, hey, this is something that, for the next 3 days, monitor these 3 things. And if you start seeing these symptoms, this is when it's emergent, or, you need to get into the doctor's office, or, this is something you need to be seen for now or tested for now. I think that has been a huge help. And it's given a lot of us some relief to know that we can just call in and get those answers really quickly.
Yeah, I feel like there's so much mystery around COVID-19 still, but we really have learned a lot.
Yeah, long COVID, I know that some people are out there still
suffering. Absolutely, yes. And those symptoms are not minor. I mean, huge brain fog and fatigue. Some feel like, physically fatigued, not just the, mental fatigue. So it's really serious, and we have a lot of questions that need to be answered related to those.
Thank you, Dr. Becky Dawson, epidemiologist from Allegheny College. Done such a great job of helping us weather the pandemic and everything that we learned through it.
Now a household name.